Well, I think I have done enough talk, and I need to get out of here and have the speaker to begin to share very interesting cases and a story with you. With that said, Dr. Yang.
I want to thank everyone for coming out here. I want to thank PSP and Covered California, and especially Commander Song, Commander Johnson, or Deputy Johnson, and California Highway Patrol, as we wouldn't be here without you guys. Today I'm going to talk about our work using social media and work with technologies to predict and change behavior. And this is something where I went into this field of research, and what we want to do really is have an impact on the world, be able to work with government agencies and really make an impact and make change. And so it's really exciting to be here and to be around everyone here, where I want to show you some of the things that we've done, just little bits of what we can do with data, and look forward to the opportunity to work with more of you and really be able to influence change and make an impact. So first, just a funding disclosure, conflict of interest. These are our current funding sources. And I'm now going to start with a background story. So some of you may have heard, about 2 years ago, in a small area of rural Indiana, there was an HIV outbreak. And it caught people by surprise. It caught public health experts, caught the CDC, caught the people in Indiana by surprise. Came out of nowhere, and it started with 5 people became infected with HIV, turned into 10, 50. Soon in this area of just 4,000 people, about 200 people had become infected with HIV. Part of the issue was that there's a lag time in reporting. So a patient may be experiencing symptoms, go into a clinic, get tested, test positive, gets reported to the county, to the state, to the CDC, and meanwhile, through this process, more people are becoming infected. So if there were a way of being able to monitor and really predict or identify those cases faster, that would be of tremendous public health benefit. So in the case of HIV, for example, we just finished 2016, about 6 months ago. We're not going to know how many HIV cases occurred in 2016. The CDC won't know until somewhere between 2018 to 2021. There's about 2 to 5 year lag time. And so there's really a need for data and integration and being able to monitor in real time. And that's what I'm going to address today. All right, who knows? Raise your hand if you know what this is a picture of. Moneyball. All right. What is, anyone, yell it out. What's Moneyball about? Book or movie? Baseball? Analytics? Yes. Yeah, so depending upon the audience that I'm talking to, people will have different explanations for what Moneyball is about. When I talk to a stats or data audience, they'll say it's about taking data and transforming it into action. Other people will say it's about baseball. When I give a talk near the Bay Area, they say it's about how the A's became a winning team. But it depends who I'm talking to. To me, this is about how we can use data to be able to make informed decisions and improve decision making and predictions. So this, as a background for those of you who don't know this story, this was about the Oakland A's, and so this was a book and then a movie with Brad Pitt and Jonah Hill. where Brad Pitt is the manager of the A's and Jonah Hills is a statistician he pulled to help improve the team. And what they were able to do was use statistics to put together a winning baseball team, and that worked pretty well. But that was over 15 years ago. And so now we have access to so much more data than we ever did then, and new kinds of statistical and computer science methods. So in the past 15 years, if you look at things like social media, every day we have about 500 million tweets that are sent every day. Turns out about 4/5 of these tweets are sent by President Trump. There's also about 55 million status updates on Facebook. And these are just the large social media sites. If you look at the smaller ones like Snapchat, 700 million snaps a day are sent. 70 million perfectly filtered Instagram photos every day. Now when I started studying this, back a while back in start of the 2000s, people were thinking, this is just a fad, it's going to go away. Why would anyone share anything on social media? But now, if people aren't sharing anything and everything, there's a problem. But are people just sharing that they brush their teeth? No, we're finding they're actually sharing information that's really relevant to public health. So they're talking about they're driving drunk. They're talking about who they're trying to have sex with and their sexual behaviors. Talking about the health service usage that they're doing, drug use they're having, and sharing really personal information about stigmatized topics related to health, like HIV. So, as a public health and psychologist who's interested in how can we use this information to make decisions, what we wanted to do was look at, could we mine social data? Could we look at some of these 500 million tweets and be able to make some informed decisions and predictions about people? So starting, this was a study we did about 5 years ago now, where we took 500 million tweets over just about a 6-month period, and we wanted to see, are people talking about things that suggest they may be at risk for HIV? Could we look on Twitter to see, are people talking about sex and drug use, which is related to HIV? And then if we could find that, could we map it on a US map to see where are these conversations occurring? And then finally, could we see, are the places where people are talking about things that suggest they may be at risk for HIV, is that where we're also finding actual HIV cases? So here are examples of the types of tweets we looked at. Sex-related tweets of someone saying, I need sex now. Or drug-related tweets, anybody want to get high? Or just general ones, watching the Celtics game. And then we put it on a US map, so this over here on the left, this is a map of the actual tweets related to HIV risk. And then down here at the bottom, this is from CDC. This is data on actual HIV cases. And what we wanted to see was, okay, now we can map and we can find out where people are talking about HIV-related behaviors. Are they the same places where we're seeing a lot of HIV cases? And we found yes. So we ran statistical models that control for a lot of things, and we found that the counties where people are talking about things that suggest they're at risk for HIV are the same counties where we're seeing a lot more HIV cases. So this was an early first study that we did just to show the power of something like social media and technology data for us to use to monitor and address issues like that first problem I mentioned in Indiana. So as a result of it, I'm from UCLA, and our UC president, Janet Napolitano, so she appointed me to bring together the University of California Institute for Prediction Technology. And what we do there is we build tools that look at the 500 million tweets a day, the 70 million Instagram photos, wearable device data, Google search data, and Waze data, which you'll hear about in a little bit. And so we bring together those data points, we run artificial intelligence on it, and use it to predict and address real-world outcomes. And so one of the great things about being funded by someone like President Napolitano, who's interested in real-world outcomes, is that we really are able to work with agencies to make change. So I'll tell you just about a couple of those partnerships right now. So here's one. Facebook was interested in having us look at how to create a safe online environment. And this is a pretty, so look over here. This was a person, this was an individual who, back a couple of years ago, in 2014, he was writing on Twitter about some things that he was experiencing psychological distress. He needed some help. And then about a month later, he killed 3 students and then killed himself. Now, we currently don't have tools available to be able to monitor these kinds of things, or they're not, we have the science and we have the ability to do it, but we're not running these things. And the argument I would make is that we need this. We have it available. We need to implement things like this so that we can stop events and we can give people like this help. Because as a psychologist, we can identify this and we can help. And we've done this at UCLA. We did a study with freshman students where we were able to track students, and we identified a student who was expressing suicidal intentions, and we routed her to psychological services where she's now getting help. We can do that with data now. We also have other types of partnerships. So for example, we work with Google and getting Google Trends data, with Twitter, with different dating and sex app sites, and with drug use researchers and organizations. And we take the data, we bring it together like I showed with the HIV example, and then what we're building are maps that are able to create actionable insights so that government officials can take action based on the predictions that we're making. So we work with the CDC, for example, right now, and we're working with different public health officials around the country to develop maps for them so that they can deploy resources to address potential disease outbreaks where needed. I'll talk right now about, I'll finish up with the example right here of a recent partnership that we have with California Highway Patrol and with Waze Google. So here's a case study. We reached out to California Highway Patrol and to Waze, and you'll hear about that in a minute more, how we did that and in the process. And we are trying to, here's the problem we are trying to address. How do we get first responders on the scene faster? So if there is an accident that occurs, how do we get California Highway Patrol and paramedics on the scene faster? Currently, just like with the example I gave with HIV, there's a lag time in having things be reported and having first responders get on the scene. So can we possibly reduce that lag time? One idea was, can we use social data to be able to reduce that lag time? Social data, it's freely available information, people are talking about it, and it's in real time. So can we use that? So what we did, we were able to get data from California Highway Patrol along with Waze alerts, and you'll hear more about Waze later on and how Waze is partnering with different organizations also. For those of you who might not be familiar with Waze, it's the crowd-sharing app where drivers can get real-time feedback about traffic and report different incidents happening. So what we first wanted to explore was, is it possible to use Waze data to predict or know in advance something that's going to be reported by the California Highway Patrol? So we looked at both California Highway Patrol and Waze data sets, and we found, on average, Waze alerts were occurring about 40 to 50 seconds before a similar CHP incident. So this gave us some knowledge that the incidents are occurring earlier, but we hadn't really paired the incidents up. So then we wanted to explore in more detail, could Waze actually be used to alert us of car accidents? So we linked the Waze data to CHP data, and we use these features here where we wanted to find, how do we link them together? We found events that were about 500 meters in proximity, where Waze reports occurred about 15 minutes earlier, and the reports occurred on the same street. Because the issue is they're not necessarily tagged in the same way, so we had to figure out how do we bring them together. And then we filtered those data points, and here's what we were left with. This, it's hard to see. Here's the eye chart right here. So what we did is that we categorized CHP data and Waze data by whether it seemed to be reported as an accident or not an accident. So we used our own categorization system for was something an accident or not. And then for each incident, we would identify, is this an accident, is it a major, is it a minor accident, using Waze data. And then we used a variety of different artificial intelligence methods. Ultimately, we used one called random forest, which is a computer science machine learning method, it's called. And what we wanted to do was see, could we use data to predict, is something a car accident or not? Well, what we found is that with about 93% accuracy, we could use Waze data to predict whether something was going to be a car accident about 40 seconds earlier than it was reported on the CHP feed. So 40 seconds before it was reported on the CHP feed, we had very high accuracy in knowing if something was going to be a car accident or not. Now, statistics that I've looked at, if you can, about 50 seconds or so earlier, if we can get first responders on the scene about 50 seconds earlier, you can save tens of thousands of lives around the United States. So this was pretty powerful, and this was something that we were able to do. We did this in the past 2 weeks. So we collected data for 2 weeks, put this together, and we were able to come up with this analysis. And this is only on a small subset of data. So I think this speaks to the power of, as Commander Song mentioned, we're using 5% of data right now, and this is just a small subset of data that was able to be provided to us without many permissions being needed. So I think what you'll hear about later on, and what I'm excited to hear more about is, how can we collaboratively work together for things like that? Now, finally, what I'll say is, I'm a behavioral psychologist, and so ultimately the purpose of this prediction and monitoring is not just to monitor, but to actually change something. If we know an event's going to happen, if we know HIV outbreak may occur, let's get resources on the scene to be able to address it. Let's try to prevent it. And so this is a book that I've written, which will be out in 2 weeks. This is going to be published by HarperCollins in 2 weeks, and it's based on the science of behavior change. It's how do we get people to change their behavior? And so based on this science, we've developed tools. Here's a platform called Health Check-ins, which is an online community, and we've been able to show how this online community, where we bring people who are at risk for HIV or different diseases, different areas, if they join this community, it incorporates behavior change science, and we're consistently able to get people to change their behavior. People who participate in our interventions for just 12 weeks, they're about 2 to 3 times as likely to change their behavior compared to people who don't. And we've done it in a number of areas. So these have been published in top medical journals in the world, in HIV, in different regions, so in different parts of the United States, with different populations, with drug use. So we have the tools for changing behavior if we can use the data to get us there. We can also change behavior around using other types of technologies for other types of diseases, for alcohol among youth we've been doing. And then finally, one question that often comes up is, how do people feel about us monitoring their data? What are the ethical issues associated with that? And so that's a whole separate topic, which we can talk about maybe at the discussion, but we do a lot of research studying the ethics around how do people feel about this type of work being done. All right, I'll leave it there. I want to thank you and encourage all of you to get involved.
Thank you, Dr. Young. That is very, very informative, and it's great to see those studying has been done, and it really gives us the very good roadmap what we can do by using the data, by understanding the power of the data.